It has been a year since the federal government approved an 80% reduction on kidney dialysis in all federal hospitals. But questions remain about the real impact of the policy on Nigerians living with kidney disease. Speaking with medical practitioners in Lagos, they agree the initiative approved by President Bola Tinubu was intended to drastically cut dialysis costs and improve access to life-saving treatment. However, lack of monitoring and inadequate support for dialysis professionals is limiting the policy's effectiveness. The report.
In 2024, the federal government announced a major relief for Nigerians battling kidney disease, an 80% reduction on dialysis treatment. The policy aimed to reduce the cost of each dialysis session from 50,000 naira to 12,000 naira, offering hope to thousands of patients who often require multiple treatments per week. Implementation was set across 6 geopolitical zones in selected federal medical institutions and officially launched in January 2025 at Abubakar Tafawa Balewa University Teaching Hospital in Bauchi State. Speaking with health practitioners in Lagos, many noted that not all designated hospitals have enough dialysis machines. Those with machines often lack trained personnel, and the absence of government monitoring and support has hindered the program's success.
I can say that is just mercenary, because the main fact that some hospitals that is government hospitals don't even have dialysis machine. They don't even have the center for dialysis. Even those ones that have it, either the machine is not functioning well or that there's no adequate power supply. And the government that does that, saying that they are giving 80%, did they follow it up? They don't monitor it, whether they are doing it or not. Because if they don't follow up, even if they have the equipment for it, they will turn it to individual use. They will not abide with what the government says, because nobody is monitoring them.
Like the impact, the 80% that reduction, it is not even working, because most people, like, they are going for private, so indirectly it is not even working. Because even in the government sector, government are still charging money for it. So the 80% that the government did is not even working at all.
As kidney disease cases rise in Nigeria, the success or failure of the 80% subsidy will determine the survival and quality of life of thousands of patients. For many, the policy is not delivering relief. Patients continue to struggle under poor funding and implementation challenges.
I don't think there's any positive impact that has been added to Nigerians for this 80% reduction. Because if the people are going to private hospitals to get dialysis and the government is not working, so what is the essence of the 80% reduction? So in Nigeria, it's not adding any value to us. So Mr. President needs to do more on health issue.
The President went ahead to say that he has reduced 80% of kidney dialysis. And every day, there are a lot of things that are going on in this country that are increase the risk of kidney issues.
The federal government maintains that the dialysis subsidy is part of a broader effort to improve access to affordable healthcare. However, for patients who rely on regular treatment, consistency, transparency, and adequate support at designated centers are crucial for the initiative to truly save lives. The issue, experts say, is not just about announcing healthcare policies, but ensuring they are fully implemented, properly funded, and supported with the necessary tools and personnel. As Nigerians continue to monitor the kidney dialysis subsidy, attention now turns to how the federal government addresses concerns around access, transparency, and capacity at the centers.